Hello, PAHO colleague. I'm Paulo Lira with the Department of Communications, and today our special guest is Dr. Anselm Hennis, the Director of the Department of Non-Communicable Diseases and Mental Health. Hello, Dr. Hennis.
Yes, hello, Paulo. Pleasure to be here with you.
Thank you, Dr. Hennis, for being with us. So today we want to speak about a very important initiative, the Better Care for NCDs initiative. Suppose I know nothing about these initiatives. Can you provide an overview in a few words?
Sure. Pleasure to do so. So the Better Care for NCDs initiative was launched by the director during the last Threatening Council in 2023. And this aims to build upon countries' current efforts to improve NCD management by improving and expanding equitable access of comprehensive NCD services within primary health care at country level. Now, the reality is that countries are already managing NCDs in primary health care. But this initiative aims to bring quality improvement to existing services so that the Better Care for NCDs initiative will strengthen the integration of NCDs in primary health care, increasing the capacity of primary health care services to deliver the essential services from health promotion through to disease prevention, screening, treatment and rehabilitation, and palliative care. And this will also include the use of integrated health networks, referral and county referral services. So in other words, people who have complications can be referred on for specialist care as appropriate and back to primary health care. And it will also strengthen the provision of monitoring of care for people with NCDs. Now, you may well be aware of the HEARTS program. And the HEARTS package was actually the hypertension management and control element of the PEN package. Now, the HEARTS package in the region of the Americas has so far been implemented in 20 countries, with a further 13 countries committing to do so. Now, HEARTS represents the hypertension management pillar of the WHO package of essential non-communicable disease interventions, so-called WHO PEN. Now, there are other disease control initiatives, which include the management of diabetes, asthma and chronic respiratory diseases, cancers that are amenable to screening and/or treatment at primary health care. These include cervical cancer and breast cancer, as well as a very important element of health promotion. So Better Care for NCDs provides a framework for a set of interventions to address main NCDs in primary health care. And in fact, this initiative has three key objectives. And they are to strengthen the capacity of health authorities to plan and implement comprehensive NCD services in primary health care, to increase the capacity of primary care services to deliver comprehensive quality NCD screening, diagnosis, treatment, and continuous follow-up care, because as you know, NCDs are chronic disorders that are not, what one cannot resolve or cure. So it requires basically ongoing recurrent uptake of services at primary health care, as well as I said before, the referral and county referral services. And the third element is to strengthen data collection and monitoring of NCD diagnosis, treatment, and outcomes of care for people with NCDs. In fact, this initiative has 6 strategic areas. One is developing country plans for scale-up and expansion of comprehensive NCD services in primary health care, community outreach and participation in NCD services with a focus on equity, because there are many persons who actually never access or have availability to primary health care services for NCDs. So we want to strengthen that, because persons who are left on the outside are those who are most living in vulnerable situations. Thirdly, strengthening normative NCD guidance and quality of NCD care improvement, because clearly if one is going to improve care, one has got to have the leading evidence-based guidance for how care should be provided. Also, it seeks to strengthen primary healthcare workforce development, because NCDs requires a multidisciplinary care approach where all team members have roles to really deliver the best quality of services. Also, the expansion of essential NCD medicines and technologies, and they're promoting the regional revolving funds. And sixthly, improvement of NCD information and monitoring. So I'll also point out that the Better Care for NCDs initiative throughout PAHO is interprogrammatic. And that means although it is coordinated by the NMH department, several other entities, namely HSS, The Regional Revolving Funds, EIH, and DHE are closely involved in this implementation, working in really strict collaboration and coordination with the country offices. And the country offices will lead the implementation in countries at the subnational and territorial level. And I really must take this opportunity to acknowledge the tremendous support and collaboration of the other departments and the country offices.
Thank you so much, Dr. Hennis. So can you explain in simple terms why we are launching this Better Care for NCDs initiative now, and why there is such a strong focus on primary health care?
Okay, very, very important question. And as we all know, primary health care is a whole of society approach to health that aims to ensure the highest possible level of health and well-being with equitable access to quality services, focusing on people's needs through the life course, along the continuum of care from health promotion and disease prevention to treatment, rehabilitation, and palliative care, and with proximity to people's daily environments. So therefore, primary health care is the fundamental context for strengthening and scaling up NCD services. Now, it's been almost 13 years since the first United Nations high-level meeting on NCDs. And in 2025, that's next year, there'll be the fourth United Nations high-level meeting on NCDs to review progress. But progress towards achieving the global targets has been very slow. And most countries are not on track to achieve the Sustainable Development Goals for health, to reduce premature mortality due to NCDs by a third by 2030. And additionally, countries have also committed to achieving universal health coverage, and the Better Care Initiative advances this priority as well. And it is important to point out that there are significant gaps that persist in the accessibility and availability of quality health services for NCDs in the Americas. So, for example, only 20 of 35, or less than 60% of countries, report having guidelines or protocols for the management of the most common NCDs through a primary care approach. That's 60%. And only 9 of 35 countries, or 26%, report having appropriate drug therapies, including for blood glucose control for persons with diabetes, and counseling for persons at high risk to prevent heart attacks and strokes. So as the region recovers from the pandemic, there are significant opportunities to strengthen primary healthcare services, focusing on improving the management of persons with NCDs, as many countries are now undergoing health system reforms. So, the Better Care for NCDs initiative is in fact based on the primary healthcare assessment and planning framework, and is expected to lead to overall improvements in the quality of care for people with NCDs, and ultimately, better health outcomes for persons living with NCDs. So, the expected impact of this initiative is improved individual decisions related with healthy lifestyle and self-health and self-management, improved rates of control for hypertension, diabetes, and asthma, among others, reduced rates of heart attack and stroke, reduced complications from diabetes, and you can see the pattern emerging, increased coverage for cervical cancer screening and treatment of precancerous lesions, and increased rates of early detection of breast cancer. So there are really clear impacts we hope to see, and the longer term, a reduction in premature mortality for noncommunicable diseases.
Thank you, Dr. Hennis. You just described a very comprehensive package of interventions. Now, suppose a PAHO colleague has the opportunity to speak to a national authority or stakeholder or a partner. What this colleague, he or she, should be saying about the Better Care for NCDs initiative?
Yeah, so I think really some of the important issues are that the Better Care for NCDs initiative is really to strengthen the integration of NCDs in primary health care, to add value in terms of quality improvement. Countries are already managing NCDs, so therefore we're hoping to strengthen and scale up existing services for NCDs in primary health care. So this includes ensuring the provision of quality services, as well as well-trained multidisciplinary health workforce who have access to clinical tools to ensure optimal care delivery, equitable access for persons with NCDs to affordable medicines and technologies to prevent out-of-pocket expenses, which are really critical. And this includes promotion of PAHO regional revolving funds, having functioning services and integrated health networks with access to appropriate referral systems, account referral mechanisms, access to digital health technologies to support health promotion and health care access for difficult to reach populations, as well as information systems to support monitoring of care delivery and clinical impact, because it is going to be really important to monitor how the initiative is working and to show that one can deliver the health impacts that you hope to achieve. So therefore, it's important for countries to invest in equitable quality services for NCDs and trained healthcare providers. The Better Care for NCDs initiative is based on a strong focus on equity to ensure inclusion of groups who are not presently accessing care or optimally benefiting from primary healthcare services. And this is to ensure access and availability for all, so that no one is left behind. I think also, I'm going to speak directly to PAHO, and it calls for each member of the PAHO family to be a stakeholder in this initiative, to ensure that as we work with member states across the 3 levels of the organization, this Better Care for NCDs initiative at primary healthcare level will strengthen and scale up quality care for NCDs in our member states in order to improve health outcomes, allow us to achieve the SDG targets for NCDs, which is a reduction of premature mortality by 1/3, and also to achieve universal health coverage.
There you go, PAHO colleagues. Let's help the member states engage with the Better Care for NCDs initiative. Dr. Hennis, thank you so much for leading this new and important initiative. And thank you for this interview today.
Thank you so much, Paulo. Pleasure to be here with you.
And thank you, colleague, for being with us today.